That. Um, yeah, Christian Reich, and I've been in Odyssey for a long time, and then OMOP before that, when it was OMOP, and done all sorts of academic and industrial jobs. And originally, I'm an oncologist, um, and yeah. But one question to you guys that I did talk, but that was another. There are these ladies from either Netherlands or Belgium, I don't know, but Dutch-speaking people, with whom we had this conversation too.
Hmm.
And apparently that's not you guys, right? Ruth and what's her name? Let's see here. Let me pull this up. Like a month and a half ago or something like this. So we talked about the whole thing with um, pre-coordination and all this
Hmm.
stuff. So now it looks like, why is stupid Outlook not searching? Something is wrong. It's nice. Give me 1 second. Ugh, what the hell is wrong with you? I can't search right now. All right, give me maybe I have to restart
Yeah,
Outlook.
we can talk a couple other things while you're
Yeah,
looking,
why don't we
Christian.
start talking and then I bring back my questions.
Yeah,
How you guys
but
all
I
doing?
can say off the top of my head, I've not talked to anybody named Ruth, so it would definitely be good to get in touch with them. We've been talking to the HIV and climate change group, and then also I think Diane Corey, who's on here, has been talking about the work her group has been doing. And I was also hoping we'd have Piper join us again. They've been doing some mapping as well, and started presenting on our last call. We were running late, and I was hoping she was going to be able to finish presenting on this call. But yeah, when you find who it is, it would be great
I'll,
if you maybe you could email an introduction, because trying to pool all of us who are doing this together. So
that's why I'm saying it. Also, the
yeah.
other thing is, what about the all of us people, the UK Biobank people, because they all have gigantic amount of these uh,
Hmm.
question answer or variable value pairs, and so they all run into the same thing.
Yes.
So
And
maybe.
somebody's gonna have to remind me at this point. Katie, you might remember. Um, I think we had somebody from UK Biobank talk. We've had people in the group or for all of us. So we've talked to all of us. I feel like we had somebody from UK Biobank come, but that was last year, and I'm feeling fuzzy on it. But yeah,
Yeah, but
we've been talking to some of the other
now
groups.
that we
Yeah.
are in introducing a bill to Congress, right? Then maybe it's a good idea to bring them back.
Yeah, that would be great. I'll check notes and see, because I we had several people present last year, and I'm feeling fuzzy on them. I know they were on our list. Yeah, thanks, Katie. Katie's like, I don't recall specifics. I'll have to go look from our notes from last year. So who's the they that's bringing a bill to Congress? Odyssey, or is it UK Biobank, or?
No, aren't we talking? Didn't we yesterday talk about the whole thing of how this is all going to be done and what we do and what the
Oh
rules are?
yeah, yeah, yeah. I'm sorry. I thought you were speaking on a national level, like
No, no, no,
like
no. I'm talking about the Congress of Odyssey.
Odyssey. Yes, yes, yeah. We definitely want to, yeah, to get those other perspectives in it. So I'll reach out, and yeah, if you can connect me with Ruth and the other person you talked to,
I
that would
said,
be good. Yeah.
yeah.
Sorry, I was like, really, we're doing that?
No,
Anyhow,
not yet. Not yet. There are other bills which have to come
the other
first.
bills. Yeah. All
Uh,
right. So quasi back to the agenda. Just a couple things I want to talk about. We've talked a lot about the definition of surveys, and we had one that we used for the landscape assessment. I've kind of refined that with some positive feedback for the book of our section and the book of Odyssey. And I just wanted to make sure I share this definition here, because there have also been some questions. Again, I wish Piper was on, because she might have been the one who brought it up, about other question answer pairs used in a clinical environment that don't necessarily meet these criteria. But this is what we're using for the purposes of this work group at this time as we start ramping up into what we can help the community with in terms of how to approach surveys. So I just wanted to make sure I shared it in the minutes. And again, it will be in our section in the Book of Odyssey. Also, sorry for the short notice on the agenda. I'm still feeling dizzy. I've been having problems with vertigo the last few days. So that's why my camera is off as well. And then some updates. We do have time at the annual Global Symposium for a 2-hour workshop that we're going to do there. So it's under the survey work group. It follows the workshop time that the Common Data Model work group will have. And some of it will depend on where we are and the things we're going to talk about next. But basically, I'm hoping to have everyone who's attending and interested in surveys there and to either review what we've come up with so far for best practices or start contributing to that list, and also thinking to just about orders of operation when you're starting to approach mapping as trying to map a survey to Odyssey. And that leads to why Christian has joined us today is we're able to finally get several leads together of the different working groups, the vocabulary, CDM and Themis and others like Christian who have a lot of expertise with OMOP and Odyssey together to start talking about the questions that the vocabulary group specifically has been getting about how to approach surveys and starting to come together with, again, what we mean by survey and setting some priorities for what constitutes a survey, what surveys we will assist in mapping, and what we mean when we say mapping. And so, like I said, Christian, I'm just going to go through it since we don't have our formal notes from yesterday, but chime in if I'm missing anything. So one of the things we talked about and aligns well with our OKRs is focusing on the standardized surveys that are used in clinical research. These are surveys that are likely, if have not already been shown to have mapping in standard mapping within the OMOP data set. There's a lot of work already going on these that has been presented. That's also going on with other groups I've talked to, like the HIV and climate change. And so this basically represents some low-hanging fruit for us to start looking at, again, sort of orders of operations and best practices for mapping the surveys. One of the other things we talked about is what does it mean when we map a survey to OMOP? Is it preserving question answer pairs, or is it about being able to ascertain things like conditions and observations, used to create concept sets and phenotypes, and basically applying the research principles that we tend to use with EHR to the survey data. And so one of the things that was decided is that it was more about the former. So if somebody has asthma and they mark yes to asthma, it's the yes that is retained, and it is mapped then to the appropriate condition, and then that is what's searchable. So you're basically creating conditions, measurements, observations that are searchable with an OMOP to actually map to create a cohort set. So it's not necessarily some of the analyses that I think people work with questionnaires are thinking of in terms of question answer pairs, but it's the most consistent with how OMOP is traditionally used. So if there are questions about that, or you had something else in mind, it would be good to discuss it. Christian, is there anything else you want to add on that point and making sure I also explained it correctly? I don't have the slides that Anna had yesterday.
Do you want to talk about the vocabulary, whether or not the survey becomes a standard vocabulary? Well, what's the relationship to the vocabularies?
Yes, we can certainly add that. But what I said about how it would be mapped to OMOP, does that make sense? About what we talked about, not doing question answer pairs, but doing like if you have the condition asthma, it's mapped like a condition as opposed to a question answer pair.
If you guys decide so.
Okay. So
So the idea is that you're going to be the gatekeeper.
the
So
gatekeeper.
so
Okay.
the first gate is a survey really a standard survey, or is it somebody just did it a
Yeah.
one-off? Okay. So do we really need this in a network? Are there ever going to be a network study, on a survey where different institutions use the same survey and the data is separate, and we want to analyze them together? So that's question number one. Because if not, don't bother OMOP. If it only exists once in the world, you don't need to standardize it. It's a complete waste of time. That's one. And the second one is for each of these questions and their answers, are these medical facts that we would like to have in the standard or OMOP tables? So are you suffering from asthma attacks? Yes, that has to go into the condition table. If we think that this is a valuable and reasonably plausible and believable fact, and then instead of having the question, do you have asthma? Yes, it gets mapped to asthma as a condition, and then it goes into the condition table, even though it comes from the survey. So this is on the table, and the idea is that there are lots of surveys. Vocabulary Group doesn't know which of them are how big and how important and how standardized and how typical and so on they are, and where their data are. So they can't make this decision, and if they can't make a decision, they just don't, and then it sits there forever, which is the situation we have right now. So what they would want, but I don't think we have finalized this yet, but the idea
Right.
is
I'm just taking the notes.
if
So
if if you
could you
guys say
describe,
this is a good idea, then we could finalize it.
yeah, could you describe Sasha's alternative? Here, say we're either doing it Melanie's way or Sasha's way, and I think Sasha's way was the question answer pairs.
And I think Sasha's way was to have it both.
Hmm.
So Melanie is, if you map, then the source of the mapping has to be de-standardized, which means no standard concept. Okay, you can have a source concept. You can write it into
Mm-hmm.
observation table, but it won't be picked up by Atlas or by any other mechanism of standardized analytics. The asthma will be the condition. And Sasha said, okay, why not both? We have the question, do you have asthma? Yes. And I think that's what he said. Did he say that? I think so.
Yeah.
I'm like 90% sure. I can ask him. So yes, so is preservation of these question answer couples pairs important for standardized research? Okay. If people do a survey and they analyze the survey, you don't have to drag all of Odyssey with you. Don't do that. It's never going to happen. It's horrible. Okay. If, however, it's a standard instrument, okay, and people will have those data all over the place, how painful is how much pain do you feel today, like these pain scales. In fact, there is no other way to get to this pain.
Mm-hmm.
Then we would want to create a proper fact concepts who are not post-coordinated. So they're no longer a variable value or question answer. They're one thing. Pain scale 5. Okay, done. You don't have to. It's just one fact instead of taking a fact and cutting it into two pieces, which for analytics is really bad. But I know that the service works that way, so
And
we're not going to get it.
what was the field that Claire was talking about would be populated, saying that the source was a survey as opposed to EHR or other data?
So the reason Claire is in this is because people saying, well, we need the source value, and right now there is no such a field.
Mhm.
For the
There's the
question.
source value, and that's one of the things that
That's
presentation comes. So we're doing that. But I also thought I'm thinking there's a type field, so that if you were creating
correct.
a concept set, you would see that this asthma yes is coming from a survey as opposed to an EHR record,
Correct.
like
The
that
fact
version.
that it
Okay.
is coming from a source that you may not trust or you want to treat differently,
Right.
that's a function of the type concept that every table has. And the type says, well, it's patient reported or survey, I don't know what it's called. And if we need a survey concept, we can make one, it's not a problem.
Yeah.
So the fact that it originally was a survey item, that we can preserve. We don't need to preserve the actual question, the actual answer.
Mhm.
If you guys think this is really, we are collecting a fact from the patient. And that's an important fact. And there are lots of those. But there are lots of those which are like, did you ever feel your provider hasn't listened to you? I mean, these kind of things, these are more sociological survey questions answered, and they need to be treated that way. And the standard epidemiology is useless for that. You can't do epidemiology with the type of stuff. So they should not become medical facts that are stated in these event tables. And so you guys or somebody needs to
Yeah.
make those
Needs to,
decisions.
make some
Yeah,
decisions on these. So thank you, Christian, for helping me fill this out. So just to sort of go linear for the group, and we can
exactly.
discuss these. So basically, and again, this goes to trying to put together some best practices or orders of operation. So as Christian is saying, from the position of being the survey work group, we get to make these decisions or decide on what it is we want to help guide and foster. But then it's also looking at what are sort of the pros and cons of doing these different things. So is this a standard survey? So again, this is our low hanging fruit. Is this a place we want to start from? I see you, Tom. I'm just going to recap real quick and then I'll open it up. Yeah. So is this a standard survey that we're interested in mapping? Does mapping exist? We might have that. And then in terms of how they're mapping, we can map it traditionally like they do for EHR, where you have asthma, yes, you map it as a condition of asthma, it's searchable, and then you keep where it came from, but you don't keep it necessarily paired with a question. You're just looking to put together a concept set or a phenotype that includes patients with asthma. Um, and then the alternative is mapping it that way, but also finding a way to preserve the question answer pairs, um, which I need a little bit more background probably from Sasha on how that works specifically. But do we need to preserve that as part of this process? And then we can look into a little bit more what that actually means in application. So these are what's being discussed. So Tom, go ahead and go with your question. And then Diane, since you're somebody who's actively doing this, it'd be also great to hear from you.
Yeah, thanks, Nicole. And hi, Christian. It's nice to meet you. I'm Tom Ahern. I'm an epidemiologist at National Cancer Institute, and along with Nicole. Um, so thanks for walking through all that, and like that was a lot to think over.
Yeah.
A couple of questions that just kind of like popped into my head that like I think might help like kind of organize some of my thoughts for me is so like I get the idea of like a standard survey. Um, but I'm also kind of thinking about like across like a lot of like the data that we work with across like the many different cohorts and epi studies. Maybe we have things like almost like standard questions sometimes. Like it
Mhm.
may be like yeah, somebody asked about breastfeeding many different ways across these things. So was kind of curious how that sort of fits into the discussion of standard survey. So same question, just asked slightly different questionnaire. Um, the other bit I would, oh yeah, and kind of related to that. So I understand what you're referring to, like kind of like searchable facts. Like, does somebody have asthma? That's yes, no. It's not really like too debatable. Um, for things that maybe aren't so commonly asked in like a kind of like a from like, it wouldn't be collected from like an EHR, things like, breastfeeding or physical activity, things like that we also commonly ask about. How has there been any discussion about how that might kind of fit into some of the these mappings to Odyssey?
Yes. So I think, and next time I'll try to get together some slides that will capture us. We just had this meeting yesterday, but I did bring this up for the same reason you said, even though these are not necessarily the same questionnaire, we do ask a lot of similar questions across epidemiological studies, and with groups like a lot of people who came to this meeting and the cohort consortium, we are interested in trying to pull those data. So we kind of have a continuum of potential things to be mapped. So the standard surveys, again, are sort of at this low hanging fruit. And then in the middle, I think we have things like you're talking about, like questions that are commonly used, or you've got a group who's interested in comparing these across, or they're of interest because they tend not to be collected in EHR. And I think that would be something that would kind of fit into the next level. But again, we'd be asking ourselves the same questions that Christian has brought up, of this pool, is this something, there's enough of or enough interest in that we want to map it? Who's going to use it? What surveys are it going to go across? Make some assessments of sort of the worthwhileness of the proposed set, and then, start looking at the questions. And I think, and then that trickles more widely to, are you going to map entire questionnaires that are unique? If they're so unique, who are they going to be compared to?
Right.
Who's putting in the effort to that? So there's sort of this continuum. But I agree, there are values in these commonly used questions, and especially for items that aren't in EHR. And then I think it's, I don't know if we need to have some sort of proposal system. Like, I know what Claire uses of the vocabularies, but basically proposing a set of questions, to harmonize, why they should be harmonized, who's interested in doing it, and then, have a procedure for how that gets moved forward. But it's definitely on the list of things that we would consider, this group would consider.
Excellent. Oh, you're on mute, Christian. Yeah, thanks, Nicole. That was helpful. Yeah.
Yeah, mute button is always a good thing. Come from the use cases, Tom. If say this is what we need or what people need, and this is how we analyze it. Okay. If you used, for example, what you're saying, breastfeeding, if you're using it generically against, I don't know, all sorts of gynecological conditions, or breast cancer or something like that, yeah, then we use it as a fact. If it is more of a sociological thing, is how is breastfeeding, what kind of outcome has it in terms of, psychological, or, is there postpartum depression, then this is a different, so I would come from the use case and saying, yep, this is a covariate in a complex epidemiological situation. We need to have it as a fact. Or really, this is more like a this gets collected and needs to be treated differently than what you typically do. If you do rates and incidences and these type of things. Okay, so if you can help us, because if you are the only people who can do this, if you can do that and kind of like categorize these things a little, and saying this would be nice this way, this would be nice this way, this one we don't need it all, don't worry about it. That would be great. Because otherwise these people, they're gonna spin forever.
Yeah, I could definitely imagine. Yeah. Okay.
Nicole, I need to run to another meeting.
Oh, sure.
It's the rehab group. I have no idea, rehabilitation work group. And the names is Esther Jansen and Rude with a D-W.
Okay.
Dallas. Okay.
Let's write this randomly here real quick. Okay, Esther Jansen.
Jansen with double S, and Ruud, R-U-U-D, and then Celles, Selles.
Okay.
And
All right.
they are in it. So they also on the book. So you should probably just talk.
Okay. Cool.
Okay.
All right. Great. Thanks, Christian.
Thanks, guys.
Okay. Cool.
I
Diane?
think a lot of the
Yeah.
stuff that, yeah, sorry. I think a lot of the stuff that we struggle with in our group could probably be categorized into those, sounds like maybe 3 different groups, right?
Okay.
So we have registry data that comes in, and we have these one-off questions. Have you ever had asthma? Or, it's not EHR data. It's asking the person, have you ever had asthma? When did it start? That kind of stuff.
Yeah.
What we do is we do categorize that to condition if we've got a date that it starts. So I'm glad that we're kind of following in that line of reasoning that you guys are also seem to be falling into. Then we've got more standard questionnaires like PROMIS that are validated instruments that really should or usually are used as a group. PROMIS is probably a bad example because you can use bits and pieces of the PROMIS, but those more validated instruments that in order to really truly analyze them, you have to ask them in a specific way and get those specific answers. So that's a different group. But then I feel like we also have started getting some, the ALS one is an example of this, where we're really trying to get to the stage of ALS, and you go through a series of, oh yeah, PHQ-9, that's perfect. Um, you go through a series of criteria, and the yeses and nos kind of feed into what stage of ALS that person has. So not only capturing that stage of ALS is important, but it's also important to know which of the criteria these people have yeses and nos associated with. And, working with the group that we're working with, where we're trying to map the data that we have, some EHR, some clinical trial, some registry data, that's all ALS, we're trying to map that to OMOP. We're trying to come up with a harmonized way of doing that.
Yeah.
So that to me is still a little bit, I understand where you're coming from, but I guess I would like to see that in practice before I can really wrap my head around it more completely. So it sounds like something like the staging might be in condition, for example, uh, but the actual questions, the criteria questions that were asked to get to that might end up somewhere else. I'm assuming
It could be,
observation, but
or I was gonna say, so a couple things that came up is sort of stuff that doesn't meet like condition measurement, you know, other areas where we keep facts would end up in things like observation. So that makes sense. And again, I think one of the other things that's important is what is the use case? Like, do you need to be able to compare these staging questions, or we'll go to promise maybe because that might be a little bit easier. Do you need to compare individual questions in promise, or is just getting that final score where it really needs to be mapped? So I think part of it is use cases, like not mapping it just because you have the data, but mapping it because there is a way that information would be used to create a cohort or a phenotype or something for analyses.
right. And so that ALS example is one of those where
Yeah.
not only is the staging important, but also how you got there is important. So those yes or no answers, that is also analyzed separately, or
Yeah.
I get not separately, but it's part of the analysis. So that information is important. Whereas I understand the sense of just asking for to grab the example again, just asking about breastfeeding for the sake of asking isn't as important as asking it because it is a high value outcome that you need to use to assess. So I kind of understand that. Uh, what I've learned working with CDISC is that if we're going to do that, we need some really concrete examples because 90% of our group discussions are, well, now I have this one. How does this fit in? So it's very hard for people not in these discussions to understand where their data fits in that hierarchy. So just real clear cut definitions, examples are something that we're absolutely going to have to come up with to make it easier for the end user, I think.
Oh, definitely. I mean, we really are at the beginning of stages of this.
Oh, absolutely.
I'm just glad we're having the conversations. I do think whatever processes we work out will involve the CDM as well as Themis, and the vocabulary group. So this is really a cross group effort. And so I'm glad we're starting to have these conversations. It's definitely giving me, because I have to admit, in my head, I've been very focused on, for example, between Connect and All of Us, or Connect and some of the other things in the cohort consortium, these are the questions we all ask. Wouldn't it be nice to be able to pull those when we're, looking at covariates or describing cohorts or things like that? And not so much thinking about what the mechanics of that actually are. So I think starting to break these things down, like we said, into different types of surveys, or different, the things that have to be assessed in sort of different ways. So, but we do need, our ultimate goal is to put together the guidelines for this, and then hopefully, have these either interact with tools that already exist, or figure out, are there tools that we need to help with this process? But it's great that you've got things that are in like sort of all three categories, because that gives us good use cases, and examples to kind of pull from, like, what are your questions? And then those can kind of help guide what we need to put into, best practices and guidance. And, and I also like to kind of think of things in order of operation. So like Christian brought up sort of the order of questions we should be asking when somebody approaches with a survey. But I think we also have, hey, I have a survey. What are my steps if I want a map? And, one of them is obviously talking to this group and then looking at what come up for procedure. Tamara?
Thanks. Yeah, I might add a fourth category, which is probably the hardest to map, which is things that aren't clinical at all. They don't really fit in the OMOP framework as originally conceived. Some of the things like social determinants of health. I mean, we ask survey questions about all kinds of things that are just not easily mappable.
Absolutely.
Yeah, I think that's helpful. I think that goes into that. And the other thing I kind of wanted to mention, and we can get feedback from that specific group, but I agree, there are things that are not clinical per se, but that I think we consider epidemiological, like what you just said, the social determinants of health. And I also think some of the things that are more social psychological, that Christian wasn't discussing as meeting that fact thing, is not something everybody would agree with. Like, we have there is a whole psychology working group that is doing some of these things. So I think it goes back into sort of, how we decide to process it. And I do think giving use cases is going to be part of that. But what are the use cases for these data? Because I think it's okay that, part of the reason we give surveys is because we want to collect data that is from the patient's point of view, but also that we don't think we can get from medical or claims records or registries or other sources, right? We feel the patient is the only way to get these data. And so, what are the questions, what are the use cases, and then going from there. Because I think if we have a use case, good use cases, then that provides justification for the effort.
Very good point.
But yeah, I would agree. I added that to the discussion. And like I said, these are early days. When the other things also, and you can reach out to me individually. Like I said, we're just starting to have these meetings. Like we literally had the first one with the leads group yesterday. If any of you want to be directly part of those discussions, as opposed to getting things secondhand here, and also I don't mind some verification that I am representing what we've been talking about. So if anyone wants to join those meetings, let me know, and I can put you, get you added to the invite list. Because I certainly hope I do a good job of representing us, but I certainly don't know all the details of what everyone is doing. And so it would probably be good to have another perspective or two from our group.
Yeah, I wouldn't mind, depending on the day and time.
Yeah. It took us like a month to get this meeting scheduled because
Yeah.
there was so many people in different parts of the world and stuff. But basically what happens is if you're on the list, they put out a doodle poll and then just try to find the one that gets the most of us on.
Got it.
Yeah,
Perfect.
so,
Yeah, if you wouldn't mind putting me on that list, that'd be great.
Okay, terrific. Any other things to think about or discussion points as we start building this out? I don't think we have to make any decisions today, but I'm glad we're talking about it. I will try to get more information from Sasha about what it means to preserve the question pairs. I don't know if these are things just end up in observation. And I'd be curious, like this aspect has very familiar use cases, right? Because we're already used to doing this with the EHR data. I have a lack of understanding as to how you preserve the question and answer pairs and how those are being used analytically. I don't know if anybody has any thoughts about how they would like to use question answer pairs analytically for something like OMUP. Because
Is
again,
this recording going to be, is it going to drop on the Teams chat website? Because I can maybe point one or two people from our group. If they get a chance to listen, they might have
well, I
some
put
insight
it
into
on,
that.
so for reasons of things that have been going on with this administration, I keep these meetings under NCI as opposed to under Odyssey, the Odyssey Teams instance. But
Okay.
I do put these do get posted to the wiki within
Okay.
like sometime between like today and tomorrow. This will be up on the wiki, and the wiki is public. So I can certainly give you, once it's posted, I can give you that wiki link. And then they can see the talk
That'd be
or
great.
the meeting. Yeah.
Yep.
Tom?
Yeah, I was wondering, so when you're talking about mapping the question and answer pairs, do you mean like I'll just keep going with like the breastfeeding example. So that could be asked a number of different ways. Some surveys might or questionnaires might provide certain categories where others just kind of say, fill in how many months or years you breastfed.
Mhm.
So you're talking about preserving that, the different way that the question was asked, and then the different possible fields that person could respond with.
Yeah, I guess along like there would have to be some harmonization, right? So unless you want to create separate concept IDs for every way the question is asked.
Well, that's what
And
I was
like I
kind of
said, if
wondering.
I
Is
need,
that what you mean by they preserving the question and answer pairs, or
so I think it's
I just might
more,
be misunderstanding it.
yeah. So for I can explain the other one better. So so for
Hmm.
example, if have you ever had asthma? Do you have asthma? All those like variations of asthma. We just don't, it's not even, just don't you don't keep anything about the question. It's just, does this person have asthma? Yes or no. If it's yes, then they get that concept for asthma and it's put into the condition. And then if I'm trying to search people who have asthma, I can search that concept ID and I can see whether it's from a survey or EHR data. But how the question was asked is not kept with it. So my limited understanding of the question and answer pairs is that you are preserving, like, you have sort of a hierarchy of the how the questions are preserved. So it's like, the question is, oh, they did a really, if I find those slides, I will share them because it's from the proposal from the group. I think Oleg is the name that comes to mind, but basically they were the ones who wanted to make sure we had a field to keep the source concept so that information wasn't lost. But they were looking at more at your map the question. So the question contains, I don't know, does your daughter have I'm going to say generic breast cancer. So you're looking at family history, right? So you would map the thing, about that the question has the daughter and breast cancer, and then the answers are, yes, no, maybe 7 years, whatever. And so you're documenting that as sort of like a hierarchical set. Like I said, it'd be so much better if I had the slides to show you, so I'll try to find those. But that's basically, it's being mapped together. Now, how much harmonization that is, like if you're trying to, it's one thing to say, I'm going to get my study into OMOP and assign these things concept IDs and map them. And that's, and anyone from all of us who wants to correct me on this, but that's similar to what, yeah, Tamara, go ahead. Because I think that's similar to what all of us did, correct?
Yeah, that's basically what we do. We
Yeah.
just give everything an OMOP ID. But I completely agree that preserving the question is important because, to give the asthma example, do you have asthma? Have you ever had asthma? Has the doctor ever told you that you have asthma? These are subtle differences, but they might make a difference to some researchers in some studies, to the extent that there should be some way for them to see what the question was. So I agree that that's an important thing to preserve somewhere, even if it's not in the main table. Maybe it links off somewhere else, but sometimes people need to know these things.
Yeah, I think so. I agree. I agree in this, in the sense that I can see people needing it. Again, I think there's trying to think again into use cases. How would you use this to define a cohort, or what other analyses you might do with it would be considered. But, other groups are doing it. It's certainly worth looking into. There's no, other than effort, there's no reason we can't do both. Is just trying to determine if both is worth the effort, or if this is something we want to iterate on. But I'll see if I can get Sasha to come talk to us and go through their example. I know it would probably help me understand better. And then you could also see how it relates to how you're thinking about it in your use cases. Diane?
Yeah, no, I just wanted to talk a little bit about how we preserve those questions now, anyway. So like you were saying, Tamara, this is the same idea, but how you get there, how you ask the question can be important. So what we usually do is we may map those all to asthma, but in the source value, we actually keep the name of the variable that from the original source data with the answer, so that people who are using the data off of our platform can go back to the original data before it was mapped and actually look at that specific question. Now, it's not everything all in one place. You do have to link back to something else, but at least it gives you that pointer so that if people are really interested in how exactly that question was answered, we give them kind of a pointer in the right direction.
And where are these links for you, Diane?
So for us, we put the variable name within the source value within the OMOP table.
Okay.
And on our platform, anybody who has the ability to see our platform has the ability to see that original source data, which has a data
Okay.
dictionary, which has the variable name and then the full text of the question, and then what type of answer. So if it's a lookup where it's almost like a pull down, we have lookups
Yeah.
where they can see exactly what those are.
Yeah.
Or if it's just numeric or, whatever the situation is.
Cool. All right. Yeah, that's helpful to know. Yeah, because is our goal just to preserve it so that you can backtrack, or is the goal to find a way to incorporate it into the OMOP mapping, or does that vary by use case? So that's definitely worth further discussion.
Yeah, I definitely agree that in some cases it's better to have it as its own separate code. But you're right. At least what we've come across so far is we have the use case guide us.
Yeah. Okay. All righty. So Piper wasn't with us today. I will check back in to see if she can join later. Yeah, I was just about to ask if we had any more discussion. So go ahead and Tom, and then
Yeah. And then just like really quick, like I think like hearing this there's definitely so much like subject matter expertise that we could like really kind of benefit from, I think, like within the cohort consortium. So perhaps as like we evolve and we have more of an understanding of like what this whole process entails, how much work, it I could imagine like going to some of the some of the working groups within the consortium, like the dietary groups, the physical activity and what have you. There's a lot of people who are experts in the field to kind of ask like, what are the critical variables? Because there's a lot of stuff out there and we definitely don't want to take in everything. So
yeah, we don't want to take in everything. And I do see this being very use case driven and very, hi, I want to harmonize. This is what I want to harmonize. How do I harmonize it? As opposed to us necessarily looking for things to harmonize. I think those are going to come to us and then, have to meet, do some sort of intake process for prioritization. Does it meet, the requirements we create for moving forward with it? Who's responsible for the work? How is it reviewed and approved? And one of the things I don't necessarily want to dig in today, but Christian also brought this out, is also specifically the vocabulary, so standard versus non-standard, and what does it take to make something that's non-standard to standard, having only standards as part of cohort definitions, things like that. So that is another conversation. So I'm not going to start that today, but I do think we're kind of putting together a list of action items for next time. So I will talk to Sasha about coming to talk to us more about their process preserving question answer pairs and kind of what does that mean in terms of how it's used for research. We should also have the notes from yesterday's meeting, which includes discussion of the vocabulary. So I can bring that up and we can kind of add that as a level of this processing and kind of figure out where that happens. So the vocabulary team is definitely open to adding more vocabulary, but again, we want to do it in a systematic way that makes sense relative to what our use cases and goals are. So I think those are two things that would be good to dig into in the next session, depending on how much time Sasha needs and what discussion comes from that. And then if not, we can punt the vocabulary to the meeting after. And then I will reach out to Piper and see if she still has things she would like to share out and we can schedule that as well. Is there anything else you would like to get, me to get information on for us or tackle for our next meeting? Okay, so I think we have a plan. I will add those action items to this list, and this will get posted with the recording, Diane. So if ever you want to refer to that, and yeah, and then we'll keep moving. But I feel like we're having the discussions we need to have at this point, and then see where we are at the time of the workshop. Is there anybody here who thinks they're going to be going to the Global Symposium this year?
Unfortunately, not me.
I'm planning to, although
Yeah,
goodness knows it can change.
Yeah, sadly, I don't think I'm gonna get approved for that.
Okay. So we'll see, but hopefully we'll have our discussions, and then we'll figure out what we're proposing and we want feedback at the workshop. And we should be able to record that as well. So then anybody who can't make it can also see what we talked about. All right. Well, thanks everyone. This has been really productive. I appreciate all the discussion and feedback, and have a great rest of your week. And I will see you on the next call. Bye.
Thanks.
Thanks, you too. Bye.
Thanks, Nicole.